Dr. Robert Olson is a radiation oncologist and research lead with the BC Cancer Centre for the North. Dr. Olson has participated in many publications, most recently with topics around stereotactic ablative radiotherapy. Welcome, Dr. Robert Olson. Let's get to know your spicy mind.
Would you like me to address you? I am Sharon, and I use she, her pronouns.
I'm Rob, and he, him.
Okay, thank you. So I'll start off with some easy questions about you. Where did you grow up? Can you tell me a little bit about your hometown?
Yeah, happy to. So I grew up, first I was born in Calgary, but then I moved to Lloydminster until I was 8. So that's a small town that's on the border of Saskatchewan and Alberta. And then I grew up in Calgary. And so to me, it made sense to start my education in Calgary because I got to stay at home for a bit of it. So I did my University of Calgary is where I did my undergraduate, and then also the medical school that I chose. After that, I did a residency in radiation oncology, and I did that in Vancouver, so at UBC. While I was still in my residency, I went and I applied and was accepted to Harvard for a Master of Science in Epidemiology. So I took a break from my residency and went back and forth, actually kind of alternating between the two. Doing my residency is you're learning the clinical expertise and giving the treatment. Well, the Master of Science in Epidemiology is sort of learning how to run trials and lead research. And so I did both of those at the same time. And then I started working in Vancouver and was recruited as the first person to come to Prince George when we opened the center. And sort of people challenged me, why don't you show people that you can lead research from somewhere small? And I really took that as a challenge that I wanted to accomplish.
Yeah, you certainly did.
Okay, a little nervous, but we'll see. No, that's not too bad.
No. Okay, so now that you have a peanut buttery sauce in your mouth, can you please tell me about the 3 most influential people in your life and how they've impacted you? Okay.
Fair enough. So the 3 most influential people, certainly my father has been one of the most influential people. So he really guided me to work hard and to make school a high priority. So I think he was one of them. My mom was really important in making sure that I put family first. And then I had a mentor named Ivo Olivato, who is another radiation oncologist like myself, who really taught me to put research as a priority in my career, not just being a doctor.
Oh, wow. Number 2.
Okay. Definitely more spicy.
Yeah, this is a vegan sauce.
Okay.
And it uses lots of root vegetables.
I like it.
So it's time to get a little bit more existential.
Okay.
If you could go back and give your 16-year-old self one piece of advice, what would it be?
Oh, that's difficult. I could go back to being 16 and tell me what to do. Certainly there's lots of things that I'm really glad I did. Probably I would say I would have stuck with music and sports a little further into my career. So I sort of abandoned music and sports to do academics, and I wish I would have sort of rounded out myself a little bit more in my early university days.
This is a fancy one that has, from what I understand, gold leaf actually in the sauce.
It looks more creamy.
I think of it as spicy hollandaise.
Yeah, it's got more of like a mayonnaise sort of texture.
Okay. Again, sticking with existential. If you were a color right now in this moment, what color would you be and why?
I would say I'm probably orange. I'm pretty vibrant, I guess. Pretty excited. I'm pretty almost on borderline manic, sort of really excited to get lots of things done. And so I wake up really early in the morning, say 3 or 4, and get research done. I do nap occasionally here and there, but I'm sort of just always going. And so I think orange represents me.
Okay.
It's good though.
Yeah, good flavors. Okay. Rapid fire.
Okay.
So please answer the following questions as fast as you can with 1-word answers. What is your pet peeve?
Ignorance.
What is your favorite word?
Fantastic.
What is your least favorite word?
Researched.
Name a 4-letter word that starts with the letter B.
Bump.
If you had to change your first name, what would you change it to?
Einstein.
What is your favorite pet?
Dog.
Have you ever worn socks with sandals?
Just to do chores. So, yes.
Okay. Number 5.
That one's different.
It's got quite a zing to it. Okay. So this is a more open-ended question. Can you tell me about your field of study?
Okay. So I do research in radiation oncology. So oncology means cancer treatment, really, or cancer research, and then radiation is specifically the modality that I use. So, and I mostly do clinical trials. So we actually experiment with people, like they're obviously subjects. And so the main form of treatment that we do is we randomize people to get one type of radiation versus another, or get no radiation at all, to see what the impact of that radiation is.
Okay. Okay, can you tell me a little bit about radiation in such a way that makes radiation not seem like a scary thing?
Yeah, so it's not. So really radiation, using a technical term, is photons, which is the same thing as light. So it's just higher energy. And so essentially we plug our machines into the electrical outlet, and we get electrons that get shot in a machine that make photons, which are just high energy light, essentially. And it can go through a body, and it go, like it used to be that we caused a lot of side effects because we treated big squares. Now what we do is we carve the dose in really specialized shapes just to treat the tumors. And so it causes damage, obviously, or else it wouldn't cure cancer. So it causes DNA damage, which then causes the death of the tumors, but we keep that damage away from normal tissue now. And so side effects are getting less and less because we're getting more accurate with our technology.
That sounds wonderful. I remember when I was in grade 9, my family had gone on a trip and we went to a nuclear power plant. Wow. And they told us that we were all radioactive. We all had a radioactive signature, so wow. Just because everything on the planet does.
Yeah, so when we give radiation, most of the time people are not. So sometimes we give radiation internally, so we place radiation at somebody, but most of the time we actually just shine the radiation through the patient, and they actually aren't radioactive. So that is, cool. Yeah, so often people think that they might be radioactive, but you're not after.
No, that's really cool. Thank you.
So radiation oncology is a specialty where you treat cancer patients with radiation. There's different ways of giving radiation. The main way that you do it is people are laying on a bed, and radiation comes from a big machine that rotates around you. It's called a linear accelerator. And so the radiation oncologist is sort of the captain of the team. And so we organize and we describe the radiation to patients. So when they come to us, we tell them about their diagnosis, which is quite shocking usually when you have cancer. We sort of tell them what the chance of cure is and where radiation fits in versus chemotherapy, which is what medical oncologists give. And then after that, we prescribe the radiation. And we sort of do some behind-the-scenes geekiness. So like part of my job is actually coloring, it seems like, because I take CT scans, which are scans of people's bodies, and I outline where the tumor is, and then I outline all of the normal tissues close by. So for example, if it's a lung cancer, I color in the lung cancer, and then I color in the esophagus and the big blood vessels that are close by, and then we give the dose to the lung tumor while carving the dose away from the other spots. And we do that with a team of people, so medical physicists, radiation therapists, nurses help us, and so we sort of, we personalize radiation to each patient as they come through the door. So it's a pretty interesting job. We're curing a lot of people, but we're also helping people who've got cancers that we can't cure. We're making them feel better. We're helping them with their pain, or if they're bleeding, and radiation's quite good at that. So it's sort of a well-rounded job. Sounds sort of geeky, but it's actually pretty important.
I'm a geek at heart, so I think it's great.
Thank you. I put a lot on there.
Ooh. Should have warned you, this one actually has a kick.
Okay, yeah. Yeah, I'm starting to think about water.
Okay. So, in today's world, why do you feel your field of study is important?
Well, unfortunately, cancer is still a pretty important disease, and a lot of people unfortunately pass away from it. And so if we can make people live longer and cure some people with radiation or other interventions, then I obviously want to do that. So I think it's kind of an obvious one.
Yeah, I like that one.
Yeah, it's good.
Yes. So, what's one lesson your field of study has taught you that you think everyone should learn at some point in their life?
What's a lesson I've learned from my field of study? Certainly it's to work in teams and to build off of the strength of other people around you and not try to do your work on your own. So any research is hard to do on your own, but certainly clinical trials, I rely on a big team of people. And I'm lucky that we've been able to hire people to Prince George to lead clinical trials right here. From a relatively small town, we're leading international clinical trials, and it's because I've sort of given the leadership to other people, not tried to hold on to all the decisions myself, but also giving them the opportunity to lead.
Okay. Okay, number 9. So this one's actually a spicy barbecue sauce. Yeah. It's very full flavor. So what do you consider your greatest professional achievement?
I think my biggest achievement is some of the recent clinical trials that we've done. So we've led a large 400-patient trial where we tried an experimental type of radiation that in the past has been shown to have high rates of side effects. And we were able to change the radiation in such a way where we carved the radiation dose away from important organs. So say you're treating a lung cancer, we'd carve it away from the esophagus, like your swallowing tube. And we were able to reduce the side effects by using our technique, sort of like a collaboration between medical physicists and radiation therapists and nurses and oncologists. So I'm the most proud of that trial, which is internationally recognized.
Yeah, it's definitely been in the newspapers a lot lately. How did Prince George get that clinical trial?
Oh, well, so a lot of work by us. So at first, we took steps in being involved in clinical trials. The first step we did is we opened up other people's trials. And so like my friends in Ontario or places in the States would open up clinical trials and they'd ask us if we could help accrue patients, which means put people on the trials. We did that. But then we decided that, well, why do we have to just be contributors? Why can't we be leaders? And so we put in a lot of work. We applied to grants. We got money from fundraising. Actually, Prince George itself did a lot of fundraising through groups such as Wheeling Warriors for the North, which is this fundraising team that cycles a couple hundred kilometers. So we got the money, and then we came up with the ideas, and we sort of like most science, we sort of take steps. So first it was, can you give this stereotactic radiation, which is called SABR? Can you give it safely? And then the next step is, well, can you give it, make people live longer? And so now we're at that phase where we're actually randomizing people to get the radiation, or SABR, versus not. And it looks like people are having a higher chance of cure by getting this radiation. So it's been a lot of work, but it's probably been about a decade in the making of opening up the trials and finishing them.
That's very exciting.
Thank you.
Okay, so last sauce. This is the spiciest of the sauces.
I'm prepping with water.
Cooling down the tongue, clearing that palate so you can absorb all the heat. This is a lovely heat with a lot of sweetness in it.
Okay. Yep, it's spicier.
Yeah, a little kick.
Yeah, that one's good.
Okay. So you have made it to the end, so it's time for the bonus. Okay. So now that you have tasted our gauntlet of sauces from all over beautiful British Columbia, there's sauces from Tofino, from Salt Spring Islands, we have sauces from the Okanagan and right here in Prince George. Is there anything you would like our viewers to know? Like, what's next for you? Any special projects coming up? Shameless self-plug?
Well, I think people should consider working in medicine and in healthcare. And it used to be that people thought of nursing and doctors, but there's lots of options: nurse practitioners, speech language pathologists, occupational therapists, physiotherapists. There's a lot of things that you can actually train now in Prince George, and I'm really proud of the team that we've grown at the university. And I think it's a really rewarding career, and certainly you're going to be in demand. You won't have a problem getting a job if you consider a job like that. So that's one of the bigger things I would sort of put a plug into being in healthcare.
That sounds wonderful. Well, thank you so much for enjoying our sauces today.
Thank you for having me. It was
Thank
great.
you for coming in.